Hello everyone, myself Dr Madhu MP. I'm a consultant medical gastroenterologist here at Aster RV Hospital, JP Nagar, Bangalore. So today I'm here to talk to you about another procedure we do commonly, that is colonoscopy. What is colon? Colon in medical terms means large intestine. So basically the colonoscopy is done to look for the large intestine. So that is the procedure that is performed. So before moving on to the colonoscopy per se, let me talk to you about how our food pipe looks like. So this is our oral cavity. Once we take the food goes through a passage called esophagus. Then it enters into the stomach portion where the food is usually stored for about 3 to 4 hours, where the digestion of the food will start with mixing of acid, pepsin and other enzymes which are secreted in the stomach. Then once the food is churned and produced into smaller particles, the food will enters into a small intestine. So the central portion what you can see is a small intestine, where the food usually goes through that with the added other juices. So food will be absorbed in the small intestine, then finally it enters into the large intestine where it is usually stored, and once you are comfortable, socially acceptable area, you can pass out your stool. That is how the food pipe is. Who are the people who require colonoscopy? Colonoscopy is usually done whenever there is a symptoms related to your lower intestine or lower abdomen. So what are the symptoms? You can have altered bowel habits, like you are having loose stools which is not improving even after 4 weeks, or if there is any new onset of constipation, or if there is any bleeding during defecation. Either it can be a fresh blood or an altered blood, or it can be an unknown bleeding. Sometimes people may come to us with low hemoglobin, means especially for evaluation of anemia also we do colonoscopy, and it is done to screen elderly people who have pain abdomen, or if there is a bleeding, to rule out if there is any malignancy or the cancers related to the colon, or we do screening for colon cancers if there is any family history of colorectal cancers, or it's also done in individuals in which tuberculosis or Crohn's of the small bowel are suspected after a CT scan or certain imaging. Once it is decided that we have to do a colon, so how it is done? So usually the preparations are different from endoscopy. Endoscopy requires only fasting, whereas the colon, the normal large intestine, usually stored with lot of amount of stool. So we have to clear everything out, then only we can see that large intestine better. So usually it's a daycare procedure. The patient has to be in the hospital for about 3 to 4 hours. So we usually call them in the morning hours with only liquids, not on without breakfast. Once they reach hospital, we give them some solution. Either it is in the liquid form or a powdery form. It will be mixed with a good amount of water, usually about 1 liter to 2 liter of water. So the solution will be taken by the individual over 1 to 2 hours. So once you take that solution, you will have loose motions or the loose stools, so that you will have about 7 to 8 times liquid stool. So once you clear everything out, or once the bowel is completely clear, you will have a clear stools. So then after about half an hour later, we usually pass a scope from the anal area. So we reach up to the end of the large intestine, and some small amount of small intestine can also be visualized during this procedure. That is called ileum, or we usually call it as a terminal ileum. These are all the examination can be done. The procedure time can vary anywhere between 15 minutes to half an hour depending upon the complexity of the procedure. So during the procedure we may do some biopsies, or if there is any polyps means basically it's an extra growth, we may remove them, or sometimes we may take biopsies. So how procedure is usually done? 90% of the procedures can be done without sedation. So with the availability of the advanced and the well established scopes, most of the procedures are painless. So a lot of people have the fear saying that colonoscopy is very painful. That is not the case. So most of the procedures can be done with mild abdominal discomfort. Once the procedure is done, patients are usually advised to go to restroom so that they pass out some air and gas so that they feel comfortable. So if somebody is anxious, worried, so in such individuals, the procedures can be performed with sedation also, where it is called conscious sedation. Patient will be given an injection so that they sleep off for about half an hour. So once the procedure is done, such individuals will be observed for 1 to 2 hours in the hospital. So and they usually advise not to drive on that day. So once the procedure is done, you can have your normal meal, and we usually call them if you have taken any biopsy or removed their polyps. We usually advise them to meet us after about 3 to 4 days with the biopsy report. Accordingly, such individuals can be managed. So to conclude, colonoscopy is a very safe procedure. It's a daycare procedure, and very effectively it can be done without much of pain. So for any further queries, you can write to us. We are more than happy to answer your queries, or you can visit us as JP Nagar, Aster RV Hospital, Bangalore. Thank you.